So I'm going to explain the bone marrow aspiration that Dr. Bergum does here in our clinic. So when he does this procedure, we pull everything from the back of the pelvis here. And everything we do in clinic, and it comes specifically from the patient that we are treating. We do not use any donor products or any other samples from outside of our clinic. So everything that we draw is going to come from the back side of the pelvis here. The surface of the bone does have some sensation, but deep in the bone cavity, there is not going to be a whole lot of sensation. So what Dr. Bergum is going to do is numb up the surface of that bone. Then, once that is numb and the patient is comfortable, he's going to use a bone trocar, kind of like a really big needle, and bore into the back of that pelvis, into that bone cavity. He's going to go in at 3 different depths, and he's going to get a little bit of bone marrow from each section there, because studies have shown you can collect stem cells and many other growth factors from different layers if you just get a little bit from each and then bore down a little further and get a little bit more, rather than drawing all from one site very quickly. Since we are able to go in those little increments, a little bit at a time, patients often don't have a lot of pain. I would say maybe 1 in 10 patients report having enough pain to really mention something during a procedure. Otherwise, patients only describe a little bit of discomfort, and more often that's going to be from a pressure change within that cavity. We are able to control that pain with some pain medication that we have via IV sedation. Other than that, he is able to do that from both sides of the pelvis if needed. Procedure takes about an hour, and it is very well tolerated by patients. Stem cells will repopulate in that area in a matter of months, depending on your age. So if we need to go in and treat another body part, we can do so within anywhere from 4 to 8 months, depending on your age, as those repopulate in the back of your pelvis.